My guest today is David Merritt, the Senior Vice President for External Affairs, Blue Cross Blue Shield Association.
Rising healthcare costs are a financial anchor for too many Americans, and it's been a financial anchor for too long. Blue Cross Blue Shield companies, we cover, serve, and support 118 million people across the country. So we feel a responsibility really to take on this crisis. No one can really solve it alone because the system is so interconnected. So you need private sector leaders like Blue Cross Blue Shield, you need government leaders, you need physician leaders, hospital leaders to come together really to address this crisis together. The higher the price for delivering care, the higher the price insurance that patients pay. And we all have a part to play, not only in getting patients the care that they need, but getting patients the care that they need at a price they can afford. There are three real big solutions that we look to for this savings. The first is around hospitals. There are effective solutions, I think common sense solutions, that can actually bring down the costs that hospitals charge, that can save upwards of about $500 billion. The second area is around prescription drug pricing. And we think if you introduce more competition to the marketplace, you get more choices for patients. And when you have the combination of choices and competition, that always brings down costs. And then the third area is around consolidation. Consolidation actually constrains choices and limits competition. So we think taking that on, not only in the pharmaceutical space, but also on the corporate health system side, when you have more choices, you will have more choices at lower cost. More than half of all healthcare spending happens in a hospital. That is where we need to start because there's so much savings to be had in the hospital setting. And so there are two ways that we look at healthcare affordability and fair and reasonable hospital billing. Facility fees are something that hospitals have increasingly used in recent years to just tack on additional fees when they treat a patient. So it could be a couple $100, it could be a few $1,000s, but it's not tied to any particular service or procedure. It's literally just a markup. The second is around the variation between sites of care. When a hospital buys a doctor's office, you could be seeing the same doctor, the same nurses using the same technology, but because the name on the door changed from independent physician office to now hospital outpatient department, you could be paying 5 to 7 times more for the same exact service that you've always had. Wow. It just doesn't make any sense.